Hello, I'm Karen. Welcome to Karen Massey Therapies. In this short video, we're going to talk about how to use oral placement therapy to achieve lip closure. So this one is for all those children who have a naturally open mouth posture or who struggle to bring their lips together for functional activities such as speech. So we're thinking of the speech sounds M, P and B. You might want to start with facial massage. So you can use your fingers or you can use any different material that your child tolerates. You can also add vibration, even using an electric toothbrush, that would work if your child needs increased sensation to develop enough awareness. And all the massage movements are going to be working towards the lips. That's important, that we're not working away, but that we're working always towards the lips. So you can massage down the cheeks and down the sides of the nose and up the chin. And when you've got the lips together, you're just going to linger on the lips so your child can feel what it's like to have their lips closed. Okay, so that's one thing you can start with. Sometimes after a while of doing the facial massage, you'll notice that your child's lips part and you get the open mouth posture again. There are other things that we can do. One of the other things we can do is to use step 1 of the bubbles hierarchy, which you may have already seen in one of our previous videos, but I'll show you again in case you haven't. So it's about popping a bubble onto the lips. It increases awareness and also promotes a natural response of the lips coming together in a lip smacking motion. Okay, so as they're doing that, we're going to be modelling the sounds M, P and B. If you need to create a longer duration of lip closure, and it's not just about the awareness and the placement, then another activity you can do is using what's called a tongue depressor. It just looks like an iced lolly stick. What you do is you place it horizontally between the lips clamp down onto the stick. Initially maybe only for half a second, but what you're aiming for is for your child to be able to close down onto the stick for longer periods of time, so building up to 25 seconds of holding the stick. And then you can begin to make the activity even harder by taping pennies onto the ends as your child increases in strength and endurance. Okay, so there are a few different activities. That's not all of the activities. We can also use horns with flat mouthpieces, but they are just some ideas to get you started. Thank you for watching this video. Please subscribe to our YouTube channel. If you'd like to find out more about supporting children with autism and childhood apraxia of speech, please check out our book. It's available now on Amazon. And if you'd like to come along and join us at one of our networking or workshops, we would love to see you. Our events are currently for parents and also for speech and language professionals, and they're in Manchester in the UK during January. We'd love to see you soon. Thank you.